if you can't play golf because you have back pain or sciatica and your rehab looks like bird dogs and dead bugs and just core stability exercises and maybe some glute stretching, how are you ever going to be able to play golf, which requires rotation and hinging, if you can't practice these activities? Extending through the spine, squeezing through the glutes, right? That follow through on a golf swing, and you load up and press back into that backside SI joint. This is a really common spot for golfers. That back leg has that glute pain, right? If you can't do these activities, how are you going to play golf? What about if you never ease into it? You say, oh, I feel better, let's go play golf. But you didn't take time for graded exposure. Let's just practice short game for a while. And I trust me, you need to practice your short game, right? And then do just putting and chipping. And then eventually we do a 3/4 swing or a half swing, a 3/4 swing, full swing, a half bucket of balls, a full bucket of balls, 9 holes, 18 holes. If we don't use graded exposure, if you're impatient because golf is your whole social life, then of course you keep flaring it up every time you do golf. So stop complicating rehab. It's not about your pelvic tilt. It's not about your hip hike or your leg length inequality or your scoliosis. It's not about your disc herniation. It's about you need to practice the activities that prepare you for golf. If your rehab doesn't do that, of course you're not going to get better. So you need a plan. You need to be able to train the things that prepare you for the activity that you want to be able to do, whether that's golf or picking up a child or running or whatever. You got to practice for those activities. So we're doing a live training this Wednesday. If you want to know how to put this stuff together and you want to get a plan, then comment live 7. Show up live. There's some free bonuses for anybody who shows up live, and I will see you there.